In September 2001, I stood up from sitting in a chair and fell to the ground. I thought I had simply sprained my ankle. The pain started to intensify and continued to spread throughout my body. Within 6 weeks, the director of orthopedic surgery at a prominent Boston hospital diagnosed me with a disease called reflex sympathetic dystrophy. He said, "The disease is incurable and all you can do is go to pain management." I spent the next 4 years of my life going for second opinions and endlessly searching for new studies and alternative treatments for the disease. During this time, I underwent multiple pain management treatments and took numerous drugs. I completely lost my life. Specialists kept telling me to accept my disease and get a wheelchair. The more they told me to give up, the harder I fought. Finally, 4 years after the original diagnosis, I went to yet another specialist. She informed me that I was the 8th patient in her career that had been misdiagnosed with reflex sympathetic dystrophy due to nerve entrapment syndrome from a sprained ankle. She assured me that after I had surgery, I would be able to walk and run again. While I was awaiting my next appointment, I went to my chiropractor and explained her theory. He moved all of the bones in my foot, and within 11 days, my pain disappeared. With the help of my chiropractor and my physical therapist, I am fully recovered. I thought I could put this nightmare behind me until April 2007, when my daughter was hit in the thumb with a lacrosse stick. I brought her to the hospital, and when the doctor examined her hand, I could see that he was going through the checklist of reflex sympathetic dystrophy symptoms: injury, discoloration, cold temperature, and pain. He told her that she had RSD and needed to go to pain management. It happened that fast. It was less than a minute and he came to the diagnosis. My daughter was in tears because she knew what I went through. Immediately I contacted my chiropractor. He examined her hand and told her that she probably had a bone bruise. We followed up with a hand surgeon. He placed her in a cast, and within 3 weeks she was perfectly fine. Another parent would not have known about reflex sympathetic dystrophy and would have listened to the advice of the doctor. Fortunately, I could prevent my daughter from the pain and suffering I endured. It seems unbelievable how a mistake like this happened to me. Then how could it possibly happen to my daughter 5 years later? I believe the doctors who cared for me really did want to help, but the healthcare system that they must operate within is broken, and because of that, I was harmed. The system must change to improve quality of care, prevent errors, and save lives. Healthcare consumers should expect a doctor to order the appropriate tests. With second opinions, only the factual evidence should be shared amongst doctors. Prior physicians' opinions should not be shared. That would truly be a second opinion. If all of these principles had been in place, I would not have been misdiagnosed, and the rest of my story could have been prevented. These changes must be made in order to spare other healthcare consumers the pain and suffering I endured.